Yeah, you're welcome to this edition of Straight Talk. And my name is Abdul Latif Abubakar, just the anchor of this program. Straight Talk is a program of solace based communications that dwell and examines issues that revolves around what is happening in our environment and how we can prefer solutions to some of these issues. This and on today's edition, we have Dr. Umar Jibril Madigawa, the medical consultant with Electromedical Nigeria, with a sister company in United Kingdom, Rabi Medical, and is a general surgeon who will be talking to us on a roadmap of what we're supposed to do to get our health sector right, considering what we have on ground presently. Hello, doctor.
Yes, thank you very much, Abdul Latif Abubakar, for having me in your show. And I really appreciate the hard work that you people do to highlight and broadcast all the issues affecting Nigeria, and particularly on this occasion on the healthcare delivery system.
So, if you look at it, considering your background as a medical consultant of decades of experience, what are the things that we're supposed to serve as as an agenda for the current president on how to put our health sector right?
Right. Nigeria has a multitudinal and very, very heavy, challenging issues affecting the health situation in Nigeria. And I'm quite pleased to hear from all the various speeches that uh, Mr. President has highlighted and his intention to bring Nigeria to a competitive country in terms of healthcare delivery system. And part of the things that Nigeria would recommend is that to address the situation that we find ourselves in, horrible multitude of challenges that have gone for decades that Nigeria
Okay.
has to um, put on in place.
So if we look at it, one of our major challenges in Nigeria that we all understand has to do with the issue of primary health care. That is, if we look at the stages of health access to healthcare services, we talk about the primary healthcare, we talk about the secondary, and we talk about the tertiary. Can we take it from the primary level?
Right. I can say to you, in any country in the world, 90% of the health problems is seen and dealt with in the primary health system before it even goes anywhere. And even until today, even in Nigeria, 90% of patients that are seen in the tertiary and indeed the secondary healthcare in Nigeria, 90% of them can be addressed and treated successfully from the primary healthcare. And in fact, the reason why we're getting this multitude of challenges is because the primary healthcare has not contributed enough, and that is why we're having horrible challenges and multitudinal factors plaguing the tertiary system. So, and a lot can be done to improve the primary healthcare system.
So, what are the things that you think can be done? Because the primary healthcare system has sort of become just a dispensary unit, sort of in any local government whereby they exist. They've mostly become now a place for reptiles and animals to just go there and I mean have a rest, sort of.
Right. The primary healthcare, if you like, I can liken it to the heartbeat of a human being. So the
Okay.
primary healthcare is the heartbeat of the health of any nation. But unfortunately, as we're having it right now, the primary health, like you said, is more like a place for a resting place or a reptile institution where virtually nothing or literally nothing is done. And how we can improve that is by making sure that we empower the primary health system in terms of personnel, in terms of equipment, in terms of access, in terms of education, in terms of all the various facilities that will make a primary health delivery system to work satisfactorily. If you look at all the regions that we have, number one, we don't have enough primary health care in virtually every state of the country. Number two, when it comes to funding, is they are having a minuscule. It's less than 1% of what they are supposed to get. Number three, staffing. There's little minuscule people to run the primary health care. Number four, there's lack of communication between the primary to the secondary to the tertiary. Number five, we don't have even when you talk about the dispensaries that are available in the primary healthcare, the dispensaries are not even functioning because we don't have anything to put it in the dispensary. The little that we have, we cannot procure them. We cannot store them in the right place. We do not have the necessary facilities like the water, the electricity to keep all the items in a safe and viable environment for our patients to use. So all these things have to be addressed.
Incidentally, Dr. Madigawa, just in less than 24 hours ago, I was in Jigawa yesterday with my team. We went for an advocacy session. There is at a local government called Tara local government, and the village is Bordeaux. It will surprise you that the primary healthcare that we met there was a dilapidated primary healthcare that has just only one in charge that is attending to all the patients that come. He's the doctor, he's the nurse, he's the cleaner. He does almost everything around there. And these are we met a building that the roof was almost given. The roof was already open. The doors are in shambles, and even the building, the structure itself. I mean, and these are done so many other places like that in Nigeria, despite the fact that we have a primary health care agency. I mean, money is voted annually for all these agencies. So what is happening?
Yes, you're right. I had 2 years working in Afghanistan during the time when the Western nations were in Afghanistan. And in
Okay.
fact, I can tell you, for the 2 years I worked, when I worked in the primary healthcare, there was no big building, there was no air conditioned area, even though the temperature most of the time was over 40 degrees. There were no fridges, there was no electricity, but there were constant number of well-informed people, including doctors, nurses, physiotherapists, pharmacists, in all very many primary health centers. In a population of, in a rough population of 50,000, there are 6 different primary health centers that deliver screening, that deliver education, that deliver vaccination, that deliver even the basic food that people will have, because of the children, so that they don't become hungry. We have primary maternal health units where all pregnant women are seen and treated. We have even centers in where I work, particularly because being a surgeon, we have areas within in a very open space, not even a building, where
I
we
mean,
can look at
sorry,
patients'
sorry to
wounds.
interrupt you. Do you mean despite the war going on in the country?
No, yes, despite the war that was going on in the country, when the Western world went in before the Taliban took over 2 years ago, while
Okay.
this was going on, we had a relatively stable environment in Afghanistan. And I was there for 9 months in the most horrible weather you can imagine. But we were well protected from the terms of security situation. And most of the people that we employ that are working were local Afghani people with very minimal education. They were not professors, they were just primary school. We give them training for 2 months of primary healthcare, but they know how to treat wounds, they know how to look after pregnant women, they know how to educate people on communicable diseases. They know how to prioritize which patients needs to go to the primary or secondary or tertiary health centers. We have ambulances which are all very basic that will transfer patients. The roads are not good, but they are manageable. Whereas in Nigeria, we don't have that. So what I would advise when it comes to that is that uh, even though the government has allocated a lot of funds, but because the money is not appropriated, And that is why all the services are negligible and near zero.
Dr. Madigawa, as a medical consultant with over 3 decades, and you've worked in Europe, you've worked in developed countries, you've worked in war-torn countries, and considering our situation in Nigeria presently, setting agenda for the present administration, how do you think that the president is supposed to handle the issue of the health sector?
Thank you very much. Mr. President has said time and time and time again during his campaign and even most recently to say that he's going to give healthcare delivery system thumbs up. And I really appreciate that because I know that it is achievable. We have very many workers in the healthcare who are very dedicated. Even now, they are very dedicated and they're doing the very, very best with the very little they have. So when it comes to prioritizing what we need to do, we need to empower these primary healthcare centers. We need to prioritize them and categorize them. The ones that will look for maternal health, the one that will take care of child health care, the ones that will do vaccination, the ones that will look for communicable and non-communicable diseases, and basic dispensaries, basic pharmacy, basic medication, teaching staff what to do, how to take care of very, very sick patients, and how to know which one needs referral to the tertiary centers and which not.
Holistically, if you look at it, how much do we need to improve on Nigerian health sector as we speak now?
So if you look at the GDP that we're spending compared to what the United Nations set up, and in fact, what Nigeria set up itself, it says 15% of GDP will go on health. At the moment, Nigeria is spending less than 1.5% on health.
And less than 1.5%?
Less than 1.5% of our GDP is going on health, particularly when it comes to primary health, because the bulk of the money that was allocated goes to the tertiary institutions, the teaching hospitals, the district hospitals. If you look at Jigawa, for example, Jigawa has only one major federal medical center, and there are skeletal health centers done by the Jigawa state government, which is extremely negligible for the number of population that we have. We need nothing less than 50 new primary health centers developed in Jigawa state alone, talk less of states, the rest of the states of the federation. Number three, we need in the primary healthcare to allocate enough funding, and I'm talking of enough serious spending. And sir, if I may just say, it's not just giving the money, it's proper allocation of this money. You can give 1 million times over what you have now, but when it's not properly spent, it will just all go to waste. And for that reason, we need to look at our spending. We need to look at how we distribute the spending. We need to invest more on dedicated people, staff who are actually working so hard and they wish they could do more, but due to lack of funding, they are not able to do more. Like the example you gave me, one staff looking after a primary health care. This is a job, this is a place that at least 30 different people should be in. And one person is made to be the alpha and omega of that center. This is not appropriate.
Incidentally, that particular basic primary health care that I'm talking about caters for nothing less than 20,000 residents. That is in Bardo community in Jigawa, Bardo community, Tara local government of Jigawa state. So looking at the aspect in which you've been talking about, when we talk about even setting aside the 15% of our GDP for the health sector, and you've talked about it, that it is not even releasing the fund, but adequately and judiciously using this fund. That is the most important thing. We've had this all along. Since 1999 to date, there has not been a time that a large chunk of our investment has not been going into health. And there's nothing to write home about that. When you look at the issue of brain drain, we can look at the number of our health workers that depart these shores to go to Europe, to go to Saudi Arabia, because they believe that they're looking for greener pastures. I mean, how can we stop this?
As I said, again, and we all know it, this is Nigeria is a free and democratic country.
Yeah.
You will always go to wherever you can get a greener pasture. And particularly if what you have learned in the medical school, in the nursing school, in the physiotherapy school, you are not able to reproduce it. And therefore you will just be stale if you stay as longer than necessary. And that's the reason why most of the people go. It's not because of the money. It's more because of the satisfaction of or what you want to achieve in life is not achievable because of all the resources that are not existing. So part of the things that we need to do as a government, which I'm sure this new government is really interested in doing, is really addressing the issue, particularly when it comes to private health. Like I said from the beginning, more than 60 to 70% of patients that go to tertiary hospitals, the federal medical centers, teaching hospitals, more than 60% of them can be treated quite judiciously in the primary healthcare with minimal discomfort to both the patient and the government. And what we spend in the federal teaching hospitals and the district hospital, 1/10 of that is enough to treat these people if we can manage their more. And the other thing is that 60 to 70% of the patients that go to the private, which is go to the government hospitals and including the private and teaching hospitals and district hospitals, these are 90% of them are preventable diseases. I can't understand why a pregnant woman would have to travel 100 miles from where she is just to have a basic maternity care because it's not available in our village. This is something that needs to be addressed. So maternal and child health care delivery system has to start from the grassroots, which is the primary health. It's very simple. A few midwives and few midwife technicians, a few dentists and few dental technicians, few uh, mental health technicians are able to stop more than 70% of patients that go to the teaching and federal teaching institutions to treat them. If we can approach that, we'll go a long way.
If we look at two issues with just what you've been talking about now, if we look at even the spending, assuming that we're even able to meet the threshold of the 15% investment in healthcare, I mean, from our GDP, which part of the healthcare sector do you think are most critical that needs attention now?
Right. The most important is maternal and child health care. Then, secondly, we have to look at drug abuse and alcohol abuse. Then, the third, we need to look at how to stop environmental pollution because a lot of the diseases, particularly affecting children, affecting their health, affecting their breathing, affecting their general well-being, affecting their mental and brain development, is as a result of environmental degradation. We have so many communicable diseases. There's no reason on earth when we should be nowadays in 2024 why we should be having polio when a simple vaccine can take care of it. There's no reason why we should be having diphtheria when a simple two sessions as a baby can treat it and prevent it from happening. There's no reason why we should be having the diseases affected with vision. There's no reason why we should be having mental issues like we're having all over the place. There's no reason why we should be having drug abuse, which we're having all over the place. And these are things these that they don't cost a huge amount of money. It's just education, resourcefulness, awareness, and availability of simple measures that can treat all these things that is absolutely lacking, non-existent, literally non-existent. And I have
But,
worked in Europe. I
but
have
don't
seen,
but don't you think that that has to do with the political will at the same time?
yes, I totally agree. And that is why I'm very, very happy the present government is very, very keen on doing. Let me give you a simple example. A huge number of patients end up with Stroke. Why do we have stroke? The reason why we have stroke is because their blood pressure is not being monitored until it gets to a high level that it just paralyzes them. So when you have a primary health unit that does absolutely just in one section that does nothing but just to check the blood pressure and to make sure that it is okay, that will prevent a stroke 99% of the time. The same thing, we see a lot of our patients with cholera, with yellow fever, with meningitis, with now we're getting dengue fever. Sorry, not dengue fever, we're having a diphtheria. Now we're having anthrax, which is plaguing the nation. These are all very, very easily preventable illnesses. And we don't need to have thousands and thousands of dollars to do it. We can treat this very quickly and prevent it from happening.
One of our major challenge also in the health sector, assuming today, as an expert, and the president asked you and said, look, Dr. Umar Jibril Madigawa, with your wealth of experience in the health sector, with a wealth of experience in managing even the human resources in the health sector, what can you advise the government to do to bring a stop to the dichotomy, to the differences, to the industrial disharmony between a medical doctor and other health workers? Because you see, one of the major issues we have in Nigeria that leads to, on most occasions, strike has to do with strike between maybe the health workers, other health workers, and the medical doctors. How can you bridge the gap?
Right. I just recently attended a conference in Abuja, the National Hospital, and I gave them a lecture. And 90% of the people who stood up and asked questions was one of the main things they were asking is that we don't have the necessary raw materials and equipment to do the work. And therefore, we find it very frustrating. And therefore, we actually prefer to go to the private hospitals to do it. And when I say infrastructure, and I'm talking of simple things like blood pressure machine to check somebody who is having a high blood pressure, like diabetic strips just to check somebody who has diabetes and how to control it, like urine strip. I'm talking of all these things. None of it costs more than 5 naira. Urine strip to check if somebody has urine infection or gonorrhea or sex diseases.
With
These
our
are
currency
all
in the country, with our currency in the country, 5 naira cannot do that for you in Nigeria presently.
so when I say 5 naira, I'm talking about just one little strip that
Okay.
can do that can check diabetes. A strip comes in with a 50 strips in it, and by the time you and the cost of one will be just about 5,000 naira. So by the time you divide that 5,000 naira by the number of strips that you have, you see that you are saving quite a lot of money. But instead of that, people will go because it's not available. They would have to go outside where they are being charged almost that same 5,000 naira that will buy a strip that will look after 50 people.
So,
And
so,
these are just simple examples I'm
so,
giving you.
Dr. Madigawa, considering our time now, I mean, we're looking at the issue of the challenges between medical doctors and other health workers. How would you resolve these so that we
Yes.
can have an industrial harmony in the health sector?
The bread and butter of any hospital, anywhere in the world, is to look up. You start from the bottom up. No one is more important. Whereas, like a football team, when the medical team is like a team, no one person is more important than the other. Everybody is important. Everybody has a role to play, and that is from the cleaner of the hospital right to the professor who delivers complex brain surgery. Every single person has a role to play. And for that reason, everybody must be given the opportunity and be given the importance and significance of working. Unfortunately, what has been happening over the years, I have noticed, is that some people that are considered not very important are pushed to the side. They don't listen to advices. They are being constantly discriminated and pushed aside and rubbished aside to show that you are not important, you are useless, and therefore it's a collective action. When these people come to work together, they strike against the hospital or the management, the hospital comes to a grand halt. So it's very important, in order to create this harmony, to get everybody in the team and make them understand that everybody is a team player. Everybody scores a goal and everybody depends the goal. So everybody has to be given the necessary importance and significance in the community where he works. He
Thank
or
you,
she
thank
works.
you, thank you very much, Dr. Umar Jibril Madigawa, that we've taken much of your time today to attend to issues we've been able to postulate on this program. Thank you very much, and I hope whatever we'll still invite you to join us on this program, you will willingly do that, so that
Thank
at least we can use it as an opportunity to educate the people. Thank
thank
you very much.
thank you. I really appreciate. Thank you.
All the best.